Communities have made it clear that they're tired of being researched on and want to be researched with. And I think it's important that we acknowledge and build structures to support that.
Power sharing in research means not getting to make all the calls. And sometimes a lot of us are trained to, I've got a great idea, let me operationalize it, let me make it happen, and let me serve it up to you on a platter. And that literally reinforces all the old power dynamics that we are now realizing undergird the inequities we see in who's at the table.
Historically, we've been trained to default to what scholars have said. And sometimes that needs to be challenged. We need to make space for other people to share truths that we have ignored. And that advances science in really, really good ways.
One of the most important aspects of presenting data that's relating to health disparities is that I try to make sure that students understand that presenting numbers and statistics about differences in health outcomes should really be layered with multiple aspects of context.
At Source, we're really prioritizing the folks who live right here in the city. And so what that looks like for community engagement is a really, really wide view of how we are working and partnering with the folks who live here.
We're doing community engaged research. We're listening to the community. The community's voices are informing our research approaches.
We have to make sure that the people at the table are as diverse as the populations that are involved in the research. That means that participants get to have an input on what gets funded, what gets prioritized, instead of always just being the people from whom data is extracted.